Hello and welcome to Facebook Live and Zoom for Alto Health For All today. We're beads and blinging because it's Mardi Gras month, but it's also American Heart Month. So, having said that, I will introduce Jenny Jordan with CHI St. Luke's Health. She's with the Cardiology and Emergency Medicine Department. And for those of you who don't know, CHI has been here since 1954, providing compassionate health care to Texas. So give us some information about the Mega Heart Health Fair coming up, Ms. Jordan.
Thank you for inviting me. And we are going to have our 4th annual East Texas Mega Heart Health Fair on Friday, February the 27th from 10 to 2 at the Pitzer Garrison's Convention Center.
Recording in
here
progress.
in Lufkin, and we would love to.
Sorry about that.
We would love to have you attend and participate. We have over 100 vendors that provide information on living a healthy lifestyle and heart care, prevention of heart disease, and overall wellness. We will have physicians on site that can do free EKGs. For those that wish to have an EKG, they'll interpret your EKG while you wait. And then if they recognize some issues that you might not be aware of, they can refer you for follow-up to a cardiologist for a cardiac workup. We'll also have free lab testing. Will be a coronary risk profile, your A1C to determine your blood sugar. We have PSAs for men for prostate cancer identification, as well as a few other heart related and blood work that can help you identify any issues that you might want to talk about with your own primary care physician. We will also have our Baylor College of Medicine family medicine residents on site that can talk about wellness. And if you don't have a primary care physician, they can refer you to their clinic. Dr. Luke Johnson, who is an Alto resident, is also a member of that practice. And he he won't be there. He's on maternity leave, but he will, those doctors will be available to answer any questions you might have. And last year we had almost 1,000 people attend our health fair, and it's just a great, fun experience for learning how to live a healthy lifestyle. We'd love to have you.
All right, great. We look forward to that. Thank you for being here and telling us all about that.
Great. Thank you for having me.
Yes, ma'am. We appreciate you. Okay. Our next speaker will be Mr. Daniel Morris, who's a nurse practitioner with the Heart Institute, giving a presentation on heart healthy tips. And for those of you who don't know, Dr. Baccaretti has been a partner of Alto Health For All for many years, and he's the founder of the Heart Institute. Isn't that right, Daniel?
That's correct, yes, ma'am.
Okay. Please take the floor, sir.
Sure, thank you so much for having us. And just to add on to what Jeannie was saying earlier, I mean, the health fair, the Mega Heart Fair is a wonderful opportunity for people to get screening. So, I definitely encourage everybody to attend that if you can. There'll be those, she talked about the Mega Heart and the Mega Lung that's there. Those are really cool little displays to look at. Just a quick top 5 sort of health tips that I like to give my patients as I see them here at the Heart Institute. I'll share with you guys. The first one, probably the most important number I think that I could recommend for anybody to remember is blood pressure. That's a very important, in fact, one of the top modifiable risk factors for heart disease in adults. We really encourage our patients to achieve their goal blood pressure, which guidelines have tightened here recently, and anything less than 120/80 for most adults is kind of what we shoot for. Blood pressure is been called the silent killer. because most of the time people feel fine until the damage has already been done. And a lot of times there's no repairing that. So we really try to strive for prevention and blood pressure control. Lifestyle changes we encourage for people with elevated blood pressure. And in fact, lifestyle changes can affect and lower the blood pressure just as much as medications in some patients. So things like weight loss, alcohol intake, sleep deprivation, stress, which, who has stress around here, right? None of that. Sodium intake is a big one. I really try to stress sodium intake. There's salt in everything, sodium in everything, even if you're not adding it to your food. They sneak it in, all kinds of stuff. So if you're eating things like chips or crackers or cheeses, processed foods, canned soups, sodas are a big one people don't think about. All that has salt, and all those things can affect your blood pressure. So home monitoring of the blood pressure is really important. Really encourage our patients to monitor their blood pressure at home. A lot of times we see patients with white coat hypertension that come in. Blood pressure's through the roof sort of when they're at the office, but at home we see good blood pressure readings at home. So we encourage patients to bring a blood pressure log at home for more accurate representation of what their blood pressure might really be. The second tip I would have is movement is probably one of the most powerful medications I would recommend for patients. And the best part about it is it's free. So the ACC recommends, the American College of Cardiology recommends, 150 minutes a week of exercise and activity. So that's 30 minutes, 5 times a day. And that 30 minutes really doesn't even all have to be all at once. We can break that up into multiple sessions throughout the day. Even if you can't do 30 minutes a day, we just really encourage exercise in general, or any kind of movement in general. I've had patients ask me what exercise is the best exercise, and my answer to that is simply any movement or any exercise that you do is the best one. So just any movement at all is just encouraged, and the exercise that you can do is the one that we want you to do. Those exercises really range from young to old. So old people's exercise goals, or the elderly might have different goals than the young people, and their exercise and activity may just be something as simple as stretching and mobility exercises, whereas younger people, we really try to push good cardio. As I spoke on a little bit with the blood pressure, nutrition, diet is the other thing that we really encourage. The Mediterranean diet has had a lot of good data showing good cardiovascular outcomes. That's things like plants, fish, healthy fats, lean proteins, things like that. And again, we try to encourage people to stay away from the ultra-processed foods, really sugary foods that'll kind of drive up your triglycerides and your cholesterol. And, and I tell people too, I never expect that maybe you don't drink another soda, but maybe try to change to the soda with, less salt, less sodium, less sugars, things like that. Same with canned soups, try to get the low sodium soups. And moderation is key. With the idea that small changes in your diet really will hopefully make a big impact on your health. And then smoking delivery to all the tissues and the organs. And as soon as you quit, within weeks of quitting, the risk for cardiovascular disease begins to improve. Your breathing is easier. Your body will thank you if you quit. Vaping is a new thing, and that is just as bad as smoking. It still exposes the cardiovascular system to toxins and nicotine, so that's bad. And prevention is probably the last key that I would have or the last tip. The best time to kind of protect your heart from problems is really before the symptoms even start. So that's things like following up with your primary care doctor, following up with your cardiologist, taking the medications as prescribed. Early prevention is better than late treatment. So really just make sure you're compliant with follow-ups, compliant with your medications, and compliant with maintaining a healthy lifestyle. That's really all I have, I think.
Okay, great. Thank you very much for being with us today. Nice to meet you.
Thank you so much. Yes, you too. Thank you so much for having me. Thanks.
Yes, sir. Okay, Miss Lila, who is the Executive Director of Community RX Help. She's going to give a presentation on services and impact overview. And So, Miss Clay, please, you're next. Go right ahead, ma'am. Uh-oh. There we go.
So I said up to this audience that we're working towards a big and bold statement
I sent something
of
over
one common
to share
spirit.
the thing. Did you get that by chance?
Okay. We're getting some feedback somewhere.
I'm not sure where.
I think it might be Miss Kim who just joined us.
Looks like it's Kim.
Yeah.
Kim might want to mute.
Okay, I just did for her, so maybe that'll help. There we go.
Were you able to share the screen?
Let's see. Share.
If not, that's okay.
Okay, try that. It says I am screen sharing, so.
Okay, so I think it's sharing your screen.
Oh, okay. So you have to send me the request.
Okay. That's all right. I'll just go ahead and talk.
Okay.
Let me go ahead and talk. Good morning. I am Lila Clay, and I'm with Community RX Health. And what we do is we help people who cannot afford their medications get it for free or at a reduced rate. So we remove cost and access barriers to life-saving medications so that patients who typically are underserved and not able to afford those medications are able to get them. We are a nonprofit. We serve Nacogdoches, Angelina, St. Augustine, and Shelby County. And we help individuals living below the federal poverty level. And we help patients maintain healthy, stable outcomes. And we can help them be able to live more productive lives and not have to choose between purchasing food or paying the light bill and buying their medicines. This keeps our patients healthy and stable and out of the emergency room, which is beneficial to all of us, because if they cannot afford their medication, they're definitely not going to be able to afford an emergency room. And that causes our emergency rooms to become financially unviable, which is not good for all of us. So this is a win-win for the community as well as for the patients themselves. We typically help with chronic conditions like diabetes, heart disease, COPD, asthma, epilepsy, hypertension, managing multiple prescriptions for patients at a time so often. We have two programs, the maintenance medication program and the emergency immediate medication program. And now the maintenance medication program offers long-term stability, while the emergency immediate medication program is more of a short-term crisis support system. Ways we do that is we help patients apply for PAPs, patient assistant programs, which we can help them with eligibility determination and help them with all their documentation. We can help them complete the applications and submit it for them. We do all the follow-ups, denials that may happen. We can appeal those. We have a really good success rate with denials. We free up medical staff, doctors' offices, by being able to provide this service for free to the patients. We process all their refills and we coordinate with the provider every 3 or 4 months. And this allows delivery straight to the patient if the medication is not a controlled substance. Otherwise, it goes to the provider and then they can pick it up at the provider's office. But this program is very beneficial to many folks who do not know how to navigate these programs and have difficulties understanding how to do it. And like I said, it frees up medical staff in the doctor's office because they don't have to have their nurses tied up trying to do this, and often they don't have time to handle income denials and appeals. That's so much work for them that we can do. Our patients received $1.97 million in total retail medication value in 2025, which allowed them to have ongoing access for for medication for chronic conditions, and maintains long-term health stability for those patients. For patients who do not qualify for PAPs or face urgent gaps, we provide up to a 90-day supply of critical medications. We do have a 500 cap per patient per year, but these are vouchers that are redeemable at local pharmacies. So if they come to us and they qualify, they can go pick up their medications for free at that local pharmacy, and then the pharmacy bills us and we pay for those medications. Last year, because these are more emergency and more specialized, we did do about $8,466.99 worth of medications. And a lot of those were homeless and indigent. We do have 2 staff members here, about 15 volunteers who run this organization. Our office hours are from 9 a.m. to 3 p.m. Monday through Thursday. Again, we did well over 2,000 medications in 2025, which was nearly a $2 million retail value. This is a wonderful organization that's been in existence for about 25 years now. Most people don't realize that, so we're always trying to get the news out. We work with East Texas community health clinics, area physicians and specialists, emergency departments, local pharmacies. We're just a trusted referral partner within the healthcare system. We are expecting some insurance marketplace changes. Many have already occurred. People are just now beginning to understand the impact of that. This is going to cause growing medication access instability as people realize they can't afford their insurance now and insurance coverages drop. So we are hoping to expand our capacity so that we'll be able to handle this influx of new people. But every prescription we feel represents better health outcomes for the patient, fewer emergency room visits, reduced strain on clinics and hospitals and the doctor's offices themselves. Our goal is for a patient not to have to choose between medicine and survival.
All right. Great. Yeah. Community Rx is a nonprofit, is that right?
That's correct. It's totally free. Our services are free. Everything we do is free. And like I said, we have the 2 programs. So one is PAPs, but one is local foundations supply us with income that we are able to actually purchase medication straight out for when there's no PAP or, like I said, there's a gap in coverage or anything like that. Especially for the homeless, it's a really good program because an antibiotic is only $9 and some change, but if they don't have the money, they don't have the money, and they can go septic without the antibiotic. So we can provide that.
Okay, wonderful. Thank you very much. That was some very helpful information. All right. Well, we have just a couple of minutes. Miss Baker, do you have anything you would like to take the time for a moment to say or ask a question? Or?
No, I was just joining from the coalition. We were just wanted to watch and see and support and see what y'all had going on.
Awesome.
Yes, ma'am.
Thank you for being here.
Yes, absolutely.
Okay. Well, that concludes our Mardi Gras edition today. Next month we'll be back on March the 12th at noon. And not sure what the theme will be, but I do have one speaker lined up so far, and that will be Oceans Behavioral Hospital. So y'all be sure and connect back with us. I'm sure I'll have another speaker between now and then. It is Red Cross Month, Red Cross Awareness Month, so I'm trying to get a hold of somebody from Red Cross, but we'll see how that goes. So, again, thank you all for being here, and be sure and take care of your hearts, and y'all have a good rest of your day. Thank you. See y'all next time.
Thank you.
All right. And thank you for being with us on Facebook Live. Please like, comment, and share.